New York. In response to systemic problems caused by mass COVID-19 deaths, Biden administration said for first time that federal government will set staffing levels in nursing homes. While this type of regulation has been sought after by supporters of older adults and people with disabilities for decades, the suggested threshold is much lower than many advocates had hoped. He also immediately enraged by the nursing home industry and was told that this an impossible task. Awaiting criticism. Details a word made with fanfare in President Joe Biden's 2022 State of Union speech have emerged as many Americans stay out the news for holiday weekend. Establishing minimum staffing standards for nursing homes will increase the safety of residents. Health Minister Xavier Becerra said in a statement, "Citizens are victims when there are no personnel in the facilities." The proposed rules, which are now in a period of public consultation and will take years to fully enact, require staffing the equivalent of 3 hours per resident per day, with just over half an hour coming from registered nurses. The rules also require facilities to have an RN on staff 24 hours a day, every day. According to government reports, the average U.S. nursing home already has about 3.6 hours of general caregivers per person per day, including RN staff just over the half-hour limit. Still, government insists that majority of roughly 15,000 nursing homes in country, which is home to around 1.2 million people, will have to add staff under proposed rules. Chiquita Brooks-LaSure, who heads the Centers for Medicare and Medicaid Services, called the move an important first step. CMS oversees nursing homes. A senior White House official, speaking on condition of anonymity prior to announcement, said the Biden administration was open to reconsidering staffing threshold once it was implemented. "I would warn anyone who thinks that status quo, where there is no federal basis for hiring staff at the nursing home, is preferable to standards we propose," said Stacy Sanders, an aide Beccera. This standard will increase staffing in more than 75 of nursing homes, bring in more nurse assistants per bed, and ensure that every nursing home has a registered nurse 247. The new thresholds are much lower than the thresholds long considered by proponents. Following a 2001 CMS-funded groundbreaking study that suggested an average of 4.1 hours of nursing care per person per day, most U.S. facilities do not meet this threshold. Many advocates said that simply determining the point at which residents could be exposed to potential harm, without considering quality of life, was insufficient. After Democratic president brought up issue in his State of Union speech, advocates initially rejoiced and anticipated most significant change for residents since 1987. Nursing Home Reform Act. The topic was erroneously shared this week, claiming that there is no apparent plateau where quality and safety are maximized.